Starting your own practice is hard for many chiropractors. It's riddled with both struggles and successes. But here at the Chiropractic Philanthropist, we make it easy by having chiropreneurs and entrepreneurs share their struggles and lessons learned in life and business so that you don't have to make the same mistakes. And now here's your host, Dr. Ed Osborne.
Chirothin is more than just weight loss. It fits perfectly into the chiropractic paradigm of health. If you are wanting your patients to experience maximum benefits of chiropractic, longer stabilization, and a reduction in their physical, chemical, and emotional stress, weight loss and Chirothin is what you are looking for. As an added benefit, it can add hundreds of thousands of dollars and a ton of chiropractic patients to your office. To get more information or to test Chirothin in your office today, go to chirothin.com and click on the pricing tab. RATSP listeners, I have an incredible guest today, and that is actually Dr. Skip Wyss. Doc, how you doing today?
I'm doing awesome, Ed. How are you?
I'm amazing. I got your name right, didn't I?
You nailed it. Yeah, you nailed it.
300 interviews later, and I'm still not getting names right. So I know. So I got to tell you, I'm excited about this episode today. Number one, I get to talk about something that I love, which is pediatric chiropractic. But before we go there, that's my little hook for everyone who's listening. Before we go there, tell us a little bit about you, as a chiropractor, as a man, and then also, as a leader in our profession today.
Well, I've been in practice for about 10 years and a little bit over. My wife and I pretty much started straight out of school. I'm a huge family guy. I'm a huge kids person. As I proceed through life, I kind of look at things as trying to enjoy myself as much as possible and not let everything destroy me. I think that when you're in practice, the stresses mount up on you really, really quickly. I think a lot of docs have a tendency to tell you the amazing sides of practice and not tell you the really crappy sides of practice. And trying to remain a giant kid at heart is massive for me. Julie and I pretty much started from nothing and worked our way to a very, very successful office that takes care of tons of children. And the stuff that's come in and out of our office would blow your mind, as far as we don't see your everyday run-of-the-mill child anymore. We see the kids that are really, really sick, that are coming in with major problems, from giant scoliosis to major neurodevelopmental issues, which we see with so many children these days. And instead of trying to pigeonhole our office into just a neurodevelopmental office or just a scoliosis clinic or something like that, we run the most well-rounded family-based offices we possibly can. And we love that. I get to play every day, Dr. Ed. Every day, man, I get to play. In fact, I like to live my life by a certain way, and it's pretty much the secret of genius is to carry the spirit of the child into old age, which means never losing your enthusiasm for what you do, and always looking at the imaginative side of things. Case in point, I got these new kids in the other day, and apparently my entire adjusting bay is hot lava. So they were jumping rocks like toadstools from table to table, and of course one wipes out right after their adjustment. So we're going to check them again, right? And it's the imagination of kids is what's going to save us, man.
Yeah, I agree.
Mm-hmm.
I know that one of the favorite, so I have a chiropractor, clearly, right? And then my kids have I have a 5 and a 7-year-old. So they love going to the chiropractor. It's like the highlight of their week. It's
mine too.
Okay. So let's get into a quote, positive, words of meaning, an affirmation. Do you have something you'd like to drop on, docs?
I think one of the biggest things that I've learned, and my grandpa taught me way back in the 80s, was people will spend their money if they see value in you, as long as they don't have to spend tons of their time. Because their time is so incredibly important, especially now, that patients, as long as you take care of them to the absolute best of your ability, and you're so confident in what they do, and you get them in and you don't take up tons and tons of their time, they will come to you the rest of their life, because they're coming in to get themselves better and not take extra time sitting around. I think that's one of the biggest things that I always try to strive for, is never taking up more of my patients' time than what they need to clear out and get healthy. That's massive for me.
You know, that could be a really great debate on social media right now. If we posted that.
Yeah, probably.
Because I would have that, right? I mean, or that's how I felt in practice. Like, like I always felt like, look, you can't have care be inconvenient. You know, it has to be on the, you know, like that people come in, they get what they need, and then they're gone, and you love on them when they're there. That was always my philosophy. And it was never more about like, how can I give them, like it was never about the time issue. It was about the quality of time that you spent with them. Kind of like family.
Exactly. That's exactly it, man. That's exactly it. It's not all the extra stuff that you can get them to do. It's being specific and very, very fundamentally sound in what you do, that they just keep coming back, because that's what they want. They want clarity, they want genuineness, and they want you to be a real person. Yeah. And I'm never afraid to give somebody my opinion, because I feel that that's the reason why they're in my door in the first place. And it's having that quality interaction with them, whether it's 2 minutes, 3 minutes, 5 minutes. If that's what they need on that day, I'm going to take it. But I never want to waste their time with making them do something extra that I don't feel is going to help them out.
Agreed. Time. It's the most valuable asset. It doesn't matter what business you're in. It doesn't matter who it is. I always, you know, it's the most precious commodity that we have.
It is.
Let's hit on struggle. So, you know, one of the things that really connects us and bonds us together is, as I believe, you know, as a profession, as doctors, as chiropractors, is that we all experience one thing, and that is struggle. So was there ever a time where you experienced just a ton of resistance? You were in the pit, could be personally or professionally. What you learned from that experience, the gift that you took from it, and how you apply that to business or life today?
So I'll go back to my first few months in practice. Julie, and if I get emotional, I apologize, because this one's really tough. One of the biggest things that I've realized is from being a man and growing up is that men will never change until they are basically on the edge of the cliff, falling off, or have hit rock bottom literally, before they pick themselves up by their pants, pull their pants up, and start actually doing their job and being a man. And what happened was, we were 6 months into practice and we were struggling. Julie and I were trying to find a direction of where we wanted our clinic. We were coaching with an excellent coach out of Canada. He was giving us some amazing procedures, and we still use these procedures to this day. But it's getting that clarity. And what happened 6 months into practice is Julie and I I was sitting in front of my computer, and I just wrote out our last lease check, and I had $50 left in our bank account when I wrote that check out. And the next day I came into the office and we were robbed. Somebody broke in, busted into the back window, came inside, took our last $200 we had in our cash box and left. Trashed our office, cut himself coming in. He was a meth addict. The only reason why I know this is because the cops caught him, and I actually went to his trial hearing because they wanted me to testify, because nobody else would testify. And he had broken, he was looking for meth, and took that last little bit of money. And I remember walking in that day, and my office smelled like chlorine bleach. And I was like, wow, this is weird. The office smells like a pool. And I was like, well, maybe it's the x-ray chemicals that I just changed. And I remember the thought, I can still smell it right now. I was just thinking about it. And then I started looking down the hallway, and there was one light on at the end of the hallway, and it was in my office. And my office was just basically set up like your typical start-out office, where it's just a hallway with a bunch of rooms on each side, right? And I look down, and there's this bracket sitting in the middle of the hallway. And of course, I look up at the ceiling like a dumbass. And I'm like, that bracket ain't gonna fall from the ceiling. And then I look down, I'm like, that's in my cash box. And then all of a sudden, like, everything goes from tunnel vision to this giant panoramic of your eyes catching everything in the room. And all of a sudden you see things smashed and computers flipped upside down. And then you start seeing blood on the walls because this guy cut himself. He squeezed himself through a 12-inch hole, Dr. Ed. And this guy's about $135, 5'6". Like, my kid couldn't even fit through that. And it's just jagged glass that he squeezed himself through. So he cut himself up. He bled on everything. And from that point forward, I walk in the back and I know exactly the music that was on. It was the Crimea River song by Justin Timberlake. Get that, okay? and then I feel this cold breeze come through the window on my face, and I'm like, you gotta be kidding me. And to be honest with you, we ran the insurance claim to fix the carpet and fix everything in the office. And I had the insurance company came in and they declared the office the carpet was a total loss and everything because it's blood and bleach and everything. So I was like, all right. So I had this really good carpet cleaner come by and clean everything. And after we had the insurance quote go through, and he got everything spotless, and our insurance cut check that showed up was $4,000 to pay for carpet and all sorts of stuff. And I used it to pay rent the next month. And from that point forward, I looked at myself in the mirror and I said, never again will I allow this to happen to me or my family. And it was that point that I got clarity that there was too many people that needed my help, that I was limiting myself from getting to and having access to us in our clinic. And that's when I just got laser focused and I said, this ain't happening again. Our community relies on us way too much to keep their kids healthy and to keep people working properly, that I can't let this happen. I cannot go bankrupt because my community needs me more than anything else, and so does my family. And man, I pulled it up. I bucked up my bootstraps, and I started pushing forward as hard as I could, and just dove into pediatrics, and tried to figure out what I could do to help children. And at that time in 2008, you see autism, ADD, ADHD. ADHD and ADD have been around forever. But autism is this new beast that showed up in the last, I would say, 12 to 15 years. And it's really come on really, really strong in the last 5. And it's this spectrum of disorder with these kids neurologically, but it's also a spectrum of their gut and all sorts of things. But from a chiropractic perspective, you see, we can change this. We can change the way their bodies function, because what do? We clear the nervous system so it's always communicating at 100% with the brain, and make sure that brain is fully functioning, always telling the body what to do. And you see, that clears up major anxiety on the inside of these children. And I was like, man, I got to get this done. So that's what's drove me since then. And because of that struggle, I've been able to help a lot of docs get through hard times and understand. And when we get patients, and see, that's the thing, man, it's made me human, because when patients come in and they're going through major things, major struggles, whether it's financial or emotional or pivotal, or Julie and I also own a company called, we started a charity called the Spine Project, which takes care of all of our military vets at no cost. And we've been doing it for 10 years. It's just we finally got it done 2 years ago. But the thing is, it allows me to know what these people are going through and help them, and understand that there's such an emotional component to how their neurology works, and get where they're coming from when they're sitting in front of me. And then I'm never trying to sell them anything. I'm always giving them what they need, and not sit there and hoping that they sign up for the next care plan, because that's not how we work. You know, and I think a lot of chiros get stuck in that mantra of next patient up, next care plan in, and instead of looking at them as the whole patient and what we can do to help support their family. Does that make sense?
Yeah. And I mean, it sounds like you're obsessed with helping other doctors not just reach success, but pediatric family success, right? So, I mean, I think that's a perfect transition into like what you're working on and how you're helping doctors. Why don't you explain a little bit about, like, you call it a passion project, but like tell us a little bit about how you're helping other doctors.
Well, I help each other doctors through Practice Evolution Prime, and then like Prime Pediatric Program. And what it's set up to do is give them the precise clinical skills they need to have as much confidence as they can in practice. You see, when students get out of school, the last thing a student wants to do is learn, because their head is full already. And we know that. And they want to grow a practice. So they're going to start putting money into marketing and into external and internal marketing and growing their brand, which I fully get and understand. But if you pack your office with people the first and second day in office, and you don't have the right clinical knowledge and wherewithal, you just destroyed your name with all those people that came in, because you for lack of a better term, you look like an idiot, and that's not okay. So my job with Prime Pediatrics is, what we do is we set these students up and these doctors up to actually get them the better clinical knowledge so they can have the best confidence in what they do. The last thing I want to do is make the next best marketer. I think we have amazing guys in our profession right now to help us market and help us create funnels like yourself, and help us really expand our reach externally, right? But internally, nobody wants to concentrate on themselves and making themselves the best doctor possible. And they are avoiding the hard conversation of, do I really know how to take care of this patient properly? Do I really know how to look at them and assess proper care, and how often they need to be seen, and how we actually get neurology to reset in the body and in the spine, and frequency of care? Nobody wants to talk about frequency of care. Nobody wants to talk about how often we actually need to see these patients to get things to change in their body, without having to put tons and tons of things externally into them to make them work properly. So what we do with this program is we make them the better doctor. We make them the best doctor possible, and we make it convenient. And what I mean by that is that sometimes when I talk to doctors, and it happens a lot, I shouldn't say sometimes, they'll have issues with patients and they'll say, okay, Skip, how do I fix this? And they say, well, what are your metrics? Where is your basis of this? What are your exam findings? What does your neurology tell you? What are the primitive reflexes showing you? And what breaks my heart is, on the other end of the phone, I just get silent. And I'll say to them, okay, so where did you start with this patient? Well, they came in and I checked their spine and I got them adjusted. I did a little postural analysis and we were good. And I said, so what drives that posture? What drives that body sitting upright? It's the neurology, right? So didn't the body develop with certain checks and balances to keep itself working properly that we can find? They're called primitive reflexes, okay, in children. And to me, those are the alarm systems that show up. I like to think of it like Jurassic Park, when they shut down all the electricity and then they got to go chase away from the raptors to turn everything back on. Well, she turns that main switch, right? Boom, and all the power comes onto the circuit board. And then they're looking and they're like, okay, there's a problem right here at the raptor fence. I can get everything to turn on but the raptor fence. Well, that's that primitive reflex that's not integrated in that kid. That's that primitive reflex that integrated too quickly or is still prevalent in an adult. And that's why they're not moving to the next higher function, right? So that's where this program is a step ahead of everything else. And doctors have to want to be the best doctor and not take a paint by numbers approach to anybody's healthcare. There's a lot of people out there that can say, do this and do this because these colors look this way on this scan. And I get that. Scanning technology is really important. But there's so much more. And I can tell you right now, and I get a kick out of it because I'm actually getting a chance to say this on your podcast. But, dude, I finally got scanning technology 4.5 years ago. So for 6 years, I built a massive pediatric practice with having a badass neurological exam on children so I can have the utmost confidence as possible. And then I can tell that parent exactly what I need to do to get that child to heal like they're supposed to, without having to rely on extra tech to just deal with the technology that's already built into the body.
I love
and if
this.
you're willing to do that, thanks, man. Thanks. And if you're willing to do that, you can go anywhere and practice. That's the thing, man. That's what bugs me is like, okay, so you're going to get me really going here. I'm going to slow down. But what gets me is that we rely so much on technology to tell us what to do with our patients that inside of them is the computer that we're trying to look at externally to tell us what to do, instead of looking inside that patient and seeing exactly where that neural input is and where it's not being expressed, and then what we have to do to restore that communication. And you can go to an island in the middle of Fiji where there's no power and take care of every person that comes in contact with you, because all those checks and balance systems are in the body already.
Yeah.
You just have to know where to look for it. That's what makes me tick, and that's what makes me push forward. Because here's the thing, Ed, this is the thing. I don't want my children to be alone in this world, being they're the only ones getting adjusted. You see, our kids, mine, yours, everybody, every chiropractor who has kids and adjusts our kids and adjusts their kids and takes care of them. We can't be the rarity anymore. Our kids are seen as the weird ones because they're not sick anymore. Our kids are seen as weird because every kid at their school right now got a flu shot and they're out sick, and my kids are in school right now. And my daughter goes to me, she goes, "Why is everybody getting sick, Daddy? How come whenever we come back to school, nobody stays in school for the first month?" And I said, "Honey, that's just that's the stuff that's getting put into their body, and it's affecting how they're." And I said, "Babe, Peyton, you're different. You're adjusted." And I don't want that anymore for my kids. I want all these kids to have that same opportunity and that same health. So our kids aren't the freaks anymore.
The weird ones.
You know, the weird ones, because they don't get sick, or when they get sick, we let them have a fever, and we let them sweat, and we let them get uncomfortable, because we know, and this is just like in business, Ed, anything that is anything worth actual growth requires you to be uncomfortable. And it's the same thing with health. You're going to be uncomfortable a little bit when you're sick, but guess what? If you let the body do its job, you're going to kick it in the butt and you're not going to be sick anymore. That's how it works. Right?
Yeah. The one thing I'm pulling from this, and there were so many, but one thing I got a full page of notes, but is that,
apologize.
There's the confidence aspect that so many docs just think, hey, I just need to do my marketing. That's it, right? I just need to market more and market more. But here's the thing is that if you're confident, and I don't just, maybe your self-confidence, but your clinical confidence or whatever that is linked to your marketing. Yeah, part of the reason why I'm a great marketer is because I show up confidently. Right.
Exactly.
Yeah.
Exactly.
It's confidence.
And
so I love that.
It's confidence. And you have tried and true skills that you know work. And that's the thing, Ed, is you know what you do works. And you don't have to, when you're really confident in what you do, and you're whether it's your clinical skills or seeing people's change. What changed my confidence was when I started changing frequency of care for patients and actually seeing them how their body needed to be seen instead of what an insurance system told me that they needed to be seen for.
Yeah.
And when I saw a 22-degree scoliosis change in 16 weeks to go down to 8 degrees, or I see a kid that suffers from seizures, and after a second adjustment, the seizures are gone, and within 2 weeks, his EEG is completely clear. Those are the things that I started seeing, these results that actually made my confidence increase. And then to me, I don't really give a crap what people think about me anymore, because I just want to get them better. And if they choose not to take my care, that's okay with me.
Right.
And I know that somebody else will be able to serve that audience that's looking for it. But that confidence in knowing what you're doing is so key, because almost people, you can almost say people buy your confidence. They pay for you for your confidence in getting them better. But the caveat to that is to be quite frank, is that there's a lot of confident people that are confident in their own shit that doesn't necessarily work all the time.
That's super true. It does. You do need to have results, confidence with results. I like that.
That's how I see it.
I want to make sure I get some I get somewhere where docs who are listening and they're like on the edge of their seat where they can actually go to and check this out. So primepediatricprogram.com. So that's primepediatricprogram.com. And
Yeah.
now, if you're listening, actually, Doc, if you're listening on your desktop, you can actually head over to thechiropracticphilanthropist.com. So head off iTunes, head over to thechiropracticphilanthropist.com. We'll have a webpage dedicated to our discussion with Dr. Skip today, but we'll have all those links as well. So, and all the resources he's going to be providing, and it has provided today. And if you're on your mobile, go ahead and expand open those show notes, and you'll find it right there. And you can connect to primepediatricprogram.com right now. Doc, okay, you ready for this? I'm going to actually take you, and we're going to place you in the TCB time machine. You ready?
All right.
Okay, here we go. So we put you in the TCB time machine. We send you back to a younger version of yourself. This is right after you came out of chiropractic college, but you have all the knowledge and the life experience you have today. So you meet that younger self. What would you say to that younger self?
Don't have no doubt in who you are as a man, and to always push forward and do what's best for your family. All the knowledge you have is between your ears, and you just have to have clinical confidence in what you do and just keep pushing forward. That's what I would say to myself. And I get shook up about that because, dude, you know as well as I do, the shit you have to go through to be the person you are every day from your past, they're the things that make you who you are. And I would definitely say that, to just have full confidence in yourself and know that what you do is going to change lives forever, and be confident and be a damn good dad and a damn good husband. Your family deserves that.
Yeah. Yeah. I love this, and this is how I felt in practice. I wasn't changing even just the next generation's health. I was changing the generation after that too, like future generations.
Exactly, man. I adjusted a baby last night that was 5 hours old, and I sat down on the couch in the hospital, right? And I'm taking care of this little one, and I look up, and there's 4 generations of people that I've taken care of in that family.
Crazy.
From baby, through brothers and sisters, through mom, through grandmother and great grandfather. And the cool thing is, here's what's really, really amazing about that whole thing. It's the reason why I saw all of them is because I saw the baby 6 years ago first. And mom came in because baby wasn't latching right and some serious colic. And then I look around, and this lady, Ed, she's got 9 kids.
Wow.
This is her 10th, man. And just before that day, I'm sitting with this group of 6 kids, and the mom looks at me and she goes, "Here, I have a picture for you." And it's a picture of me with the kids. And she goes, "You realize you've adjusted every one of those kids?"
Wow.
And I said, "Yeah." She goes, No, you don't get this. You've adjusted every one of them. And the longest they went their life without an adjustment after they were born were 4 hours. And that's because you couldn't get down to the hospital quick enough. And I said, those are the cool things in practice, right? Those are the fun things.
Yeah. Yeah.
I love what I do, man.
Yeah. I mean, it's so true though. I mean, like there's something about, the energy, like, again, and this may not be for every doc who's listening, but there's something about taking care of kids, and the energy that they bring to your practice too. I got to tell you, if I was still practicing today, I'd probably take your course.
Man,
it'd be a lot.
I appreciate it. I've taken so many courses to get to where I am. And that's a big thing too, is, man, just not one thing's going to make you amazing. It might give you some extra, it's going to give you extra things to make you a better doctor. It's going to give you clinical excellence. But the one thing I could tell all doctors out there is that there's numerous amount of courses to take to keep honing your craft and to be amazing at what you do, and to just keep moving forward, man. I appreciate that. That's a hell of a compliment. Thanks, Dr. Ed.
No, and it's genuine, by the way. I
Thank you.
Because I was always looking for like, what is, well, and I do this today, even, now people think I'm like, or consider me more of a marketer, but, I'm always looking like, how can I improve what I'm already doing? I know that there's, people who are doing it better, and how can I learn? So it was the same in practice. And I encourage all doctors who are listening too, is that really kind of look inside yourself. Is like, when was the last time you really invested in, honing up those confidence skills? Because at some point, I was almost like cruise control for me in practice,
It's so easy to do. That's so easy to do, is to get in that cruise control and that comfort mode. And sometimes I find that whenever I get comfortable, something's going to make me really uncomfortable. And it's usually my wife, Dr. Julie. Yeah,
that works.
It usually is Julie. Yeah, she's straightening me out, man.
Okay, so one thing that we love to end our episodes and wrap up with is a resource. So if there was a resource that's like, look, all doctors listening right now need to go and listen to this, read this book possibly, or check, I don't know, this person out. Like, what is it? What would that resource be that you'd like to drop?
Can I give you two?
Sure.
Okay. One of the most important resources I find in practice right now is when it comes to technique, is either learning MC2 and tonal work, and taking tonal work then to the next level and learning cranial, and then rounding that out with learning Thompson work. And the docs that I trust most with that, I'll honestly tell you, and I get nothing out of this, is John Minardi for Thompson work, Dr. Martin Rosen for his SOT and cranial work, and then Dr. Dan Bronstein, Dr. Christina Stitcher, and Dr. Steve Hoffman for their MC2 work. Those guys are changing chiropractic as a playing field. And then I would think the best written resource right now, man, that I don't know, because I pull from so much. I would say anything that you can get your hands on regarding pediatric neurology and actually understanding how kids operate, and understanding where primitive reflexes develop in a child and at what age, like what gestational week these things come in, will give you miles ahead of any sort of other healthcare provider out there. Chiropractic is on the forefront of this. I hope that helps.
Yeah, absolutely. I by the way, I did the MC2 training, and that was that feels like so long ago now. But I did that. It was transformative for my practice, like how I approached the investment. So it was really good. I really enjoyed that. Yeah. All right. So listeners, you can head over to thechiropracticphilanthropist.com. Again, you can check out the links and the resources that Dr. Skip has actually provided as well. We'll have a webpage dedicated to this discussion. And Doc, I gotta thank you for bringing it. I would say definitely bringing the obsession and the passion to TCP today, because I talked to a lot of doctors, and clearly you have a passion, but like I can tell, like I can feel it, like that you're obsessed with helping other doctors help more kids and more families. So I want to thank you for being back.
Thank you so much. I hope at some point I'll get to talk to you again, Dr. Ed, and keep doing what you're doing, man. This is so pivotal for doctors and students. You are so important. You just need to know that.
Thank you.
So you've heard the struggles, you've heard the successes, and this episode is done. But there's still so much more to come and so much more to learn. Head on over to thechiropracticphilanthropist.com and sign up for our newsletter, where you'll receive free practice building tips and strategies, including how to market your practice with your very own podcast and so much more. Thanks for listening, and we'll see you next time on The Chiropractic Philanthropist.